If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
A healthy good afternoon to all the Q family tuned in to 100.7 QFM right now. How you? This is Peter Boyce here, and the fact that you are listening to Q, you already know that Q is good for you. But you know what else is good for you? The next 15 healthy minutes you hear on QFM, which is being sponsored by the Maria Holder Diabetes Center, along with the Barbados Diabetic Eye Screening Program. If you are diabetic or pre-diabetic and you are about to go through the door, don't go away. You need to stop and listen. Or if you have to go somewhere, make sure and listen in your car, because this program is especially designed for you. Telling you all about the Maria Holder Diabetes Center. You know where that is? Out there in Warren, St. Michael. You just catch the bus. You get off just as you pass Price Smart, and right behind Eunice Gibson Polyclinic, you will find all the diabetic services you will ever need to keep you healthy all throughout the Christmas season and beyond. They got diabetic eye screening. When was the last time you get your eye screened for diabetic retinopathy? When? Once you are diabetic, you are supposed to do that every year. There's also podiatry services to help you take care of your feet, so when you go to queue in the community and you want to dance, you know that you'll be ready. You'll be hearing from podiatrist Louise Robinson later in this show. There's also diabetes specialist doctors and nurses to take care of all of your diabetic needs. And there's also vascular screening, and that is what we will be focusing on today. A vascular screening is to check for what Bajans call bad circulation, but the medical term is peripheral arterial disease.
So exactly what is PAD?
So let me find out some more about it. So we are going to go to a person who has experienced PAD and also got a vascular screening to tell us about his experience. Let us take a listen to Donald Clark. You know Donald Clark? This is Donald Clark here.
Thank you very much, Pierre. Thanks for having me. My situation or awareness came about in 2005-06 because in 2004 I had just won my golf championship, and this was in New Jersey. I lived in the United States, and what I found was that in 2005, which is next year, I was unable to walk the golf course. So I knew that something was wrong, and I started to seek medical attention. Went to my regular doctor, my primary care physician, and he did the routine tests, and I'll never forget his statement. In fact, I got his letter to me, and he said, Mr. Clark, the test that we have done in our office is within normal limit. Any questions, you can feel free to notify us. Otherwise, I'll follow up with you in your next scheduled appointment. And it was around about that time that I'd heard about peripheral artery disease. So I asked him to schedule me an appointment for the cardiologist. And what I was feeling was kind of an irregular heartbeat. And that's what kind of triggered it for me. So I thought it was at times going to have a heart attack. So I had learned about PAD or peripheral artery disease, and I told him to check me for that. And he said, well, that could be done in your local clinic. And in a couple of days, the cardiologist scheduled me for something called an ABI test, which is, the acronym is Ankle Brachial Index. And simply put, it is like taking your blood pressure, but this time around your legs. You're hooked up. The cuff is hooked to your thigh, your calf, and your ankle. And this is on both legs. And so what they're looking for is to see the blood flow as it travels through your lower extremities, which is the peripheral part of your body. That's where this comes from. So what I found was, or what they discovered was, that I was blocked 60% in one leg. There was some plaque buildup. So the problem was that the blood was not flowing back to my heart in a normal way. And so that's when I knew for sure that, I was diagnosed with peripheral artery disease. I was suffering, with some diabetic complications, high blood pressure, and this was like constant. But no real swelling, but a lot of leg pain. My brother, Victor Clark, he was a diabetic, and I remember coming back and saying to him, this is something I think you need to check out. We grew up in the same household, ate the same food and stuff like that, and you need to speak to your doctor about this. And I remember him saying to me, if it was that, he is confident his doctor would have told him, he would have known. And months after that discussion with he and I, he had an amputation. And weeks later, he passed. And I said, I need to get this information out there because, as some person as fit as he always was, it's a silent killer, and it means silent. Once you have reached 50, you need to go and get that check done. It's peripheral artery disease. It's a simple test. It's called an ABI test, and what they're looking for is to see the blood flow in your lower extremities. And I can't stress enough the importance of getting this test done. I'm glad to know that the Maria Holder Foundation is offering this. There is, I believe, one other vascular service that offers this test as well. Individuals need to go and get that test done.
Was there any pain involved when the test was being done?
No, none, absolutely. It's a simple test. It's all external. Again, it's like taking your blood pressure on your lower extremities. In conclusion, I should indicate that this is not a male-only condition because of erectile dysfunction, but female condition as well. Ladies with varicose veins have their condition to have this ailment. So I would want to say in conclusion that women should also have this test done. Varicose veins is a telltale sign that there's a problem with peripheral vascular disease. In men, of course, it's erectile dysfunction. I mean, that's how you tell that there's a problem. That's how men would normally tell that there's something going on. There's no blood flow, or there's, I should say, a reduced blood flow to the penis, of course. But in women, varicose veins is a telltale sign that there's also a problem.
A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937 to get more information and make an appointment. Board members get 10% off.
As we continue on the Maria Holder Diabetes Center radio show, it's time for our Christmas Q song of the day. We go to the music of the band Crossfire, getting you in a Christmas mood and reminding you to have a healthy Christmas this year. This is the song Celebration. Compliments, the Maria Holder Diabetes Center. While you are celebrating this Christmas, a reminder that podiatrist Louise Robinson will be doing foot screenings at the Maria Holder Diabetes Center on Saturday, the 14th of December. Call and book today, 417-0305. Bring your foot and come.
The Maria Holder Diabetes Center.
It's now time for our Foot Corner segment of the Maria Holder Diabetes Center show, where you hear from podiatrist Louise Robinson. And instead of Peter Boyce, this is my Peter Wickham call-in show impression. We now have a caller on the line. Go ahead with your foot question, caller.
Thank you. I would like to know if, as a diabetic, if there's any tips that Louise can give me on how to take care of my feet.
See a podiatrist is one on a regular basis, either twice yearly for prevention. Watch your sugar levels, that's important. You know, diabetes is not just about the feet, it's holistic. It's about your eyes, your kidneys, your heart, everything. So check your feet daily. And what you're looking for is look between the toes. Make sure you dry between the toes. Don't let the skin get wet from sweat. Wash your feet every day. So important. Keep hygiene. Moisturize your feet, but never in between the toes. But moisturize the bottom of your feet, because that is skin also. So keep your skin intact. And please, please, don't walk around barefoot. Just put something on your feet, because if you get anything stuck in the foot, you will probably, as a diabetic, will not know about it until it's too late. And sadly, we're seeing far too much of that. That's why you should come and get your feet and toenails cut by us. So I'm here at the Diabetic Centre, at the Maria Holder Centre in Warrens. I'm here on 3 days doing everything that I was talking about. So please, it's Diabetic Month. Reach out to us. I can do a foot care assessment, footwear assessment, look at orthotics and inserts, talk about general education, how to not lose your toes, and what to look out for, and prevent a condition people have heard of, osteomyelitis. That's a bone infection. We need to stop it getting that far. We need to stop the amputations, and we need to be saving lives. And that is what I'm here to do with the other physicians at the Maria Holder Centre. So please, people, just book an appointment. Come and see us. We're a great team, and we're here to help and to fight against diabetes.
We now welcome to the show a patient of the Maria Holder Diabetes Center, Miss Dacia Moore.
Thank you for having me. I have had diabetes for just about 8 years now. I got it when I was really young. I can say it impacted my life pretty big, especially going through school and stuff. It was quite difficult back then.
What did you learn from being a patient of the Maria Holder Diabetes Center?
I learned that diabetes, don't limit yourself. It is not the end of the world, and that you can do everything a quote-unquote normal person can do. And as long as you have a good support system, you'll be okay. I utilize the diabetes specialist nurse, the podiatrist, the nutritionist. There's also a psychologist there as well. And of course, the doctor. The staff there, but it is really nice, and they're supportive, and they help me through a lot of my problems. They taught me about calorie counting, learning how to balance my meal so that I can still enjoy the sweet things and everything else that, as I said, quote-unquote, normal people can enjoy. They help me not to be insecure about having diabetes. It's something that I have to live with, and to love myself, to be confident in everything I do.
If you are diabetic or pre-diabetic and listening to QFM right now, remember Q also stands for quality. Quality health services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. For more information, call 243-3937 or 417-0305. You can also follow them on Instagram or Facebook. And don't miss next week when we'll be dealing with more diabetic issues. Same Q time, same Q station.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.